Mary meets everyone, it's Aquamarine here, and I'm going to do another part to the Healthy Witch series. I'm probably going to do another video after this one, but this one I've been wanting to do for a while. I wanted to actually etch out or highlight, the stuff that I wanted to actually talk about, and try not to make it too long. So I'm going to talk about renal failure, which is also kidney disease. And basically, what it is, well, the main function of the kidneys is to remove basically anything that is a waste. Any toxins, excess water, minerals, biochemicals. It's to basically keep the blood levels leveled. So basically what kidney disease does, it basically starts off with kidney stones. So what I'm going to read for you is they're mostly composed of calcium, salt, and to a lesser degree of uric acid. Stones are partly block the flow of urine, and this may result in infections as well as accumulation of waste matter in the blood. The passing of large stones through the urethra can be extremely painful and cause kidney colic. So, or colic, whoever name, whatever you guys say. So basically that can be very painful, and a lot of times kidney stones are caused because you're not drinking enough water. Like I've said in previous videos, you need to drink at least a gallon of water a day. If you're working out or out in the sun for a while, you need to drink more than that most likely, but it's recommended a gallon a day. So storm formation as well as bacterial infections or accumulation of toxic material may lead to acute or chronic inflammation of the kidneys, which is also called nephritis or Bright's disease. So that just shows you right there how serious this disorder is, or this disease. And usually the reason why they call it dis-ease is because your body is in dis-ease. So it's not ease right now. It's actually like in a disarray. It's not, your body's not happy. So that's the reason why it's called disease. So basically the symptoms of either Bright's disease or nephritis is a raise in blood pressure, back pain, fatigue, listless and loss of appetite, may feel dizzy and nauseated. So that's some of the symptoms. But of course, a lot of these can be a symptom of other things. You of course have to go to a doctor to get tested to find out if this is what you have. Okay, so the next thing, now I'm going to go into kidney transplants. You have to be careful when you have any type of surgery, if there's any way to actually stop the surgery, because there's a way to actually naturally heal you where you don't have that issue. But unfortunately, like I've said before in previous videos, doctors are not really aware on how to do that. So kidney transplants have a major disadvantage. Apart from the risk of operation itself, the lifelong requirement of immune suppressive drugs, which weakens the immune system. So you constantly get sick, and it can lead to cancer because you're not able to heal yourself because of the actual surgery that you had to get. It depletes any of the nutrients in your body and weakens the immune system, which is very, very bad. And that's the reason why a lot of people get sick even after antibiotics, because their immune system is weakened. So basically, kidney disease is basically of a high intake of protein, phosphate, and calcium, a low intake of magnesium, vitamin B6, and also a food allergy can cause the chronic inflammation in the body. And like I've said in a previous video, you need to get tested if you're not for sure if you have a food allergy. So that's very important. You need to check that out, because if you have chronic inflammation in the environment actually cause cancer, so you need to check that out. Proteins are generally high in phosphorus, and by restricting it decreased the progression of the kidney disease when you lower the amount of protein in the body. So it's normally recommended before dialysis, and that should help postpone dialysis for 7 months. So that's a great deal, a lot of time that you don't have to be on dialysis. So I suggest you do that if you have problems with your kidneys. A high protein and phosphate intake imposes a great increased workload of the kidneys. So basically, your kidneys are overworking itself, and that's what's causing it to become a dis-ease. High phosphate levels also cause an overactivity of the parathyroid gland, which raises the calcium blood levels. This may lead to decalcification of bones and formation of calcium deposits in the kidney stones. Arteriosclerosis, and arthritic deformations. This also raises blood pressure and damages the kidneys even more. Patients with severe renal failure should restrict their protein intake at least 20 grams and phosphorus to less than 400 milligrams. For children, as a maintenance diet, amino acid supplements may be necessary with severe protein restrictions. Allergies. A major cause of degeneration of kidneys is a chronic inflammation, like I was saying previous. So you need to find out if you have any hidden food allergies or chemical sensitivities. What they mean about chemical sensitivities is like food colorings, anything that they say is natural flavored or something like that. You have to be careful. There are reliable tests that you can do to help with that. So common natural medicine to remove infections and inflammation is vitamin C, magnesium, propolis is basically from bees. So you'll see where it says bee propolis, that's what it means. Various herbs such as echinacea, golden seal, which you can actually find echinacea and golden seal together. Garlic, and anti-inflammatory protein digestive enzymes such as bromelain. Bromelain is actually from a stem of pineapple. Omega-3 fatty acids, either from flaxseed or linseed oil, or you can do flaxseed as long as it's an omega-3. And then kidney stones. Uric acid stones form mainly in acid urine and are yellow or black. A few stones are formed from the oxidized amino acid cysteine with a waxy appearance. So, then there's something about sugar. Sugar, such as sucrose, it's sucrose, is a common household sugar, and this has severe negative effects. They have found that it increases the urinary calcium, and it basically makes it even worse for the kidneys. So most at risk from sugar are individuals with an excessive insulin response, and this includes most stone formers. So that's something very important for you to think about. So you're going to have to eliminate sugar from your intake. You can go to stevia. Stevia is a leaf. It's an herb, and it's very sweet. You can find it anywhere, at any grocery store. You can even get it as a liquid versus powder. Minerals, vitamins, minerals, and stimulants. There's 2 minerals that are negative, give a negative effect to the kidneys, which is sodium and cadmium, whatever. Those are stone-forming minerals. Cadmium, I can never pronounce. It's CADM as in Mike, IUM as in Mike. It's a metal. It's a heavy metal, and that increases stone formations. It causes renal tubular damage and can lead to calcific Foki. These are hard to say, sorry. So basically that makes it worse for you. Okay, so it is essential for cellular energy production. Elderly individuals and those on diets high in meat and fat have low levels of citric acid. Citric acid also prevents individual crystals on calcium salts from fusing together to form stones. So therefore, heavy meat eaters easily become stone formers. So, in one experiment, long-term supplementation of sodium citrate did not reduce storm formation, while potassium citrate reduced storm formation by 86%, and citrus fruit proved a high intake of potassium citrate. So that's a good thing. So you basically have to increase your magnesium supply. It tends to lower the calcium loss and inhibits the precipitation of calcium salts in the kidneys. My hair got stuck to my... So basically they found that 90% of people it was a 90% success rate from people taking magnesium. B6, vitamin B6. This is an essential from the normal metabolism of oxalic acid. A deficiency leads to accumulation of oxalic acid. In one study, oxalate stone formation was reduced with 60 milligrams of vitamin B6 daily, but not with 20 milligrams. In another study with intake from 75 to 600 milligrams of vitamin of B6 supplementation with 150 milligrams daily was found to be optimal for oxalate reduction in the urine. Very interesting. Okay, vitamin A, folic acid, zinc may help reduce the storm formation, so you can supplement that. So long-term coffee drinking or caffeine in general has been shown to result in an increase of calcium loss. So I've known this before. Basically, if you have too much caffeine, it depletes the calcium in the bones. And that's why it's so easy for people to get osteoporosis or osteopenia. So 2 cups of coffee causes calcium loss by 22 milligrams per day. So foods that are high in oxalic acid also best avoided, such as rhubarb, cacao, instant coffee, spinach, and tea. So those are stone foods high in oxalic acid that need to be avoided. So none of that stuff, okay, when you have this disorder. Okay, so there have been allegations that a high intake of absorbic acid, if you guys don't know what absorbic acid is, that is vitamin C. They say that it may lead to formation of oxalate kidney stones. But they found that the higher urine acidity from absorbic acid helps to prevent or dissolve phosphate kidney stones. So basically they found that vitamin C actually helps the kidneys from forming that way. Pretty interesting, right? All right, so now I'm going to go into meat. While all proteins increase phosphorus levels to some degree, animal protein, especially from meat, can actually cause stones. So in comparison from vegetarian urine, which excretes of calcium, oxalate and uric acid are 50 to 400% higher in non-vegetarians, not vegans, vegetarians, which vegans are vegetarians, but this is what it's saying. The higher intake of animal protein, the higher the level of the stone forming. So stone formers usually have a highest intake of animal protein. So if you're having this issue, especially with kidney failure, and you eat a lot of meat, that's the reason why, okay? That's one of the reasons. Now, this is the diet that you should be eating. So this is what I'm going to tell you next. This is very important. If anything, please, you should be writing this down anyways, or save this or whatever, or ask questions if you want, if you don't understand something. So a diet in a low allergy, remember you have to go check to see if you have food allergies, semi-vegetarian diet based mainly on fresh, raw, and steamed vegetables. And then the amount of animal protein as well as high protein legumes should be determined by the condition. If it's not too serious, that is, if dialysis is not required or expected, then fish may be used occasionally as a few eggs per week and a small moderate amount of yogurt or cottage cheese made of goat's milk. Okay, so serious conditions, also temporary, we should use mild cleansing periods. Avoid completely all animal protein, soybeans, and use of other legumes only in moderation, preferably in sprouted form. Brown rice and other non-gluten grains, cooked and raw vegetables, as well as extra virgin olive oil may be provided the bulk of energy requirement. Between and before meals, have something tart or acidic fruit, such as grapefruit, orange, pineapple, berries, and apples. Low blood pressure and sensitive skin may also have fruit meals and fruit days. Foods that are special benefit are fresh vegetable juices, which you can do like wheatgrass, parsley, celery, dandelion leaves, because dandelion is actually a very, 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 very good cleanser. Green beans and bean pod tea, cucumber, horseradish, lemon juice, fenugreek. Fenugreek is very good. Watermelon and banana. And if anything, artichoke, about the size of an egg. And try to do that for several months on a raw vegetable and fruit diet. So basically a raw vegan, a raw food vegan for a little bit. Minimize meat, sugar, and sweetened foods, cow's milk products, and wheat products, processed with foods, added chemicals, salt or salted foods, polyunsaturated oils and margarine, soft drinks, rhubarb, coffee, tea, alcohol, nicotine, baking powder, and medicinal drugs. You have to drink tons of clean water. Drink 1 liter each 30 to 60 minutes before breakfast, lunch, and dinner. And you can drink like weak herb teas, diluted vegetable juices, or water with lemon juice. You have to do frequent cleansing periods, mainly fruit only. With kidney stones, inflammation or infection of the urinary tract, and not more than a moderate deterioration in kidney function, you may take with each meal up to half a tablespoon of ascorbic acid and a magnesium supplement, either 1 tablespoon of milk of magnesia or half a teaspoon of magnesium carbonate or magnesium chloride, or less, or magnesium oxide. Take a low potency B complex, which is maybe 50 milligrams, which is a pretty good amount. Natural vitamin E, either halibut or shark liver oil capsules. I don't know. I don't know where you can get that either. With kidney stones, use an additional vitamin B6, and you should have like 50 milligrams per meal. Trace minerals, which are high in zinc and manganese. You could use that as 2 separate types of vitamins. A low potency multivitamin. A diet very low in protein, so essential amino acids. This is especially important for children. So you need to get supplement of amino acids. Suitable herbs to improve kidney function. These are mild diuretics, so this also helps water retention, and that's going to be corn silk, dandelion, elder, and juniper berries. peach leaves, and uva ursi. I actually use uva ursi. That's very good for bladder infections, and if I use it for bladder problems, but you can use it for urinary tract infections too. Warning, okay, warning. If on dialysis, do not stop your normal dialysis routine when starting on this nutritional program. Instead, phase it out gradually according to the result of the urine and blood analysis tests. Salt and castor oil packs over the kidneys can be really beneficial. Wet a cloth with a concentrated warm Epsom salt solution. Place it over the kidneys. Keep warm for 1 to 2 hours with a hot water bottle. You could probably get one of those, you know, they look like whoopee cushions, but you can fill it with hot water. At other time, okay, then you could use warm castor oil on a woolen cloth. Keep warm. Repeat these packs frequently with inflammation and pain. A fresh outer cabbage leaf over the kidneys may also bring relief. Adopt a routine of meditation and relaxation exercises, like guided imagery meditation type. Constipation can contribute to kidney problems. So what you need to eat is psyllium husk. That's very, very good for cleansing and stuff. So you can do that. And so if you are on any medication, there's some common ones that there's calcium acetate. It's what's very beneficial when you are on these medications. This medication is basically to prevent the high phosphorus blood levels in people for the kidney failure. So you need to actually take zinc. Zinc is very important because it's depleted from this drug. So you need to have zinc in your diet, okay? And you need to avoid calcium when you're on this. So that's very important. Then there's this other one called amlodipine. This is a calcium channel blocker used to treat angina and high blood pressure. You need to avoid pulsary root, and you need to check and see if you can have any intake of grapefruit, pomegranate, and DHEA, which is funny because in some of the treatment that I was talking about, you can consume acidic fruits, but because of this drug, you cannot consume those acidic fruit. So that's it for renal failure. I hope that this answered your question. And also to people out there that have this and don't know what to do. So I hope that really helped, and have a wonderful day. Blessed be.